So here we are live again, and we are back. And today we are full of confidence, and because today's topic is very, very exclusive, and I know at the same time this topic is not popular in the health and the doctor community, right? Because I know that when it comes the word sales and selling something, it's something seems like that the dishonesty, something like that unloyalty. But this is, I would say, the one of the top skill when it comes to uh, generating or convincing or even helping whether a regular customer, whether uh, a patients, right? So I genuinely believe I had though like the misconception about the sales, like the offer and something like that. You know, it has been like very overlooked over the years when I actually started my journey. And first of all, that my like style of to make communicate with you, it's totally real and raw. And I don't like if you like come up with an expectation that you are going to get all the like refined, polished, even let's say that perfect way, perfect all the informations that I'm going to provide with you, probably it would be like waste of your time. I just here to like talk with full of empathy, full of intuition, right? And I want to make sure that this uh, totally align. Even if somebody like watching this my video right now, I would probably invite to join over here, bring up you here on, and just start to like understanding and getting like your questions and concerns. Even I would love to hear your stories. And specifically, that we are now talking about the dental industry, dental world. So they are probably that we gonna like understand as you as a practice owner, as a dentist, that what is your concern when it comes to when you hear the sound of like the sales word and the offer, something like that. You and even all everyone knows that dentistry is like super professional, right? It's a very uh, high class, even. Yes, of course, there is no doubt, but still that your profession, how um, efforts and how um, the create, I mean to say that that the time you have invested to learning and this kind of like skill sets to acquire this skill set. But also that general person, as a normal people, they are actually as a patients when they walk into your uh, like the door and the room of like you, actually they don't have that much knowledge about your uh, practice or your clinical stuff. But there is like all the normal people like me as well, that how you actually first care themselves, and then they are going to get that the feeling that you care them first, and then you as a human being, that how you as a treat yourself, and then you share your like plans, um, the treatment plans actually, right? So different stages of like different sales process, that the way that actually works, so you can reassess and that visualize these steps, maybe that someone. So just remember this, I'm again focus, I'm again like giving you a reminder that it's just a raw discussion here, and I like to share this because I made a promise myself in order to like becoming a like an authority, and becoming um like trustable business and brand development partner for the dental and health doctors, right, industry. So from that standpoint, I know that where I am belongs, and I'm targeting to like serve a US based dentist and healthcare professional. So found that I found an interesting idea, and have also like been like looking at other people's how they are building their personal brand on online, just being authentically and sharing their authentic voice. So from that standpoint, I just want to make sure that I'm not a like a popular or a famous person, like the popular person like in dental world. Rather, you just have to keep in mind yourself that I'm just here as a beginner, just what I have learned over the past years of my branding, business, design perspective. Now as a like acting as like a marketer, whatever you can say, the thought leader. So it just a point that I just wanted health and the doctor's standpoint, right? So when like the patients walk into your room, uh, and it is not about to like uh, explaining them explaining them about your treatment plan. Rather, it is first impressions. It's builds how you actually treat with them, how you actually embrace their concern, right? How you actually give them a space to think, space to like make decision, right? And different stages, different phases, like based on that, according to the uh, like the patient's uh, patient. So maybe, for instance, let's say a patient who is like first time visiting your uh, clinic, right, your practice. So you might need some form of like implants, or kind of like service cosmetic or orthodontics kind of things. So that's first steps. uh, Maybe he is not the kind of like sort of like the phase. This is where actually he wants to learn, he wants to check and reassure the quality and the people, the team, then everything that they want to make sure before they want to like get their treatment. They want to learn, they want to get more information, right? So it's not only, let's say that when we say that sales, uh, that when a patient's uh, walk into your uh, the room, consultation room, the way that actually talk with you before that case acceptance, that how accepting the case, how you actually approach to them, how you give them the importance, uh, like like the informations they need to know about. So you gotta be little bit of like concern about those things and understanding their journey, that how they actually make their buying decisions, or they actually book uh, like appointments, something like that, because that's the appropriate word, I think. So you gotta be understand this which ways actually they do. So sales is, you see that something that what happened inside when they enter your consultation room, but it can be the early stage. There are several stages you can actually build this. They also they have gone through, and that makes them help them to make a decisions to book appointment. For instance, your social media post, that something that you have shared, uh, and before and after transformation for a like an past or the recent patient uh, outcome, right? And they probably get much more credibility. Even there are like serious, like critical issues out there in dentistry, can be a surgical thing. So how do you actually share more information about this to make this that kind of information so they can actually take? So when you like share this information on your website through blog, so they can actually learn from that actually from, and they can make a decisions. So if you are not like investing on doing this the right way, this is kind of a, that all kind of approach, all kind of marketing approach is to like increase your sales, book appointment, right? Whether it is SEO you are trying to do, whether you are trying to do build a brand, any approach. So either you have to like invest on this kind of thing. uh, there are two options like you can follow. Let's say that if you want to grow, and you can like, either you can skip the part, let's say that the uh, media communication, it's all the thing that actually happened for through the communication, right? So it can be like physical or in person conversation, and it can be through the media conversation, right? So how you actually walk them towards to your sales funnel, and they get the confidence, they get the influence to take your uh, service, take your consultation, right? So from that standpoint, there are so many things that matter when it comes to like making an impression, right? And then create an experience. So it's not only that your verbal communication, but it also you have to look at your visual communication as well, right? So there is a word, it says that a picture, it's like tells or like the thousands of words, right? So it tells a story. You don't need to like tell thousands words to express, but when someone can see it, but when they cannot see, they can't believe. So seeing it is form of like believing, right? So when they believe, that sort of like way that you can craft your visual language in order to make a good conversations through visually, there is a high chance to like building trust, and it can help you to increase your sales. It's not about I'm again like emphasizing or again stating that it's not about that how you sales is only a part of, like, let's say that how you verbally communicate to your patients or the team, but it is more and more correlated with the visual language as well. So you have to maintain both things. But oftentimes that when you have a better experience, right, and let's say that uh, it's like a great, it's like so many things that uh, included with one thing, and I interconnected with one thing. Let's say that I am um, elaborating these things from the branding standpoint, marketing standpoint. I mean the sales, that how I'm trying to like elaborate these things, since I have like talking about these things and the business standpoint, right? So when it comes to branding, and you know that branding, people like builds their like interior, their clinical physical space. Like if you look at that, the like popular clinic or dental offices, so that there we will see that the branding uh, encompasses uh, entire clinic, starting like from the interior to the website. So everywhere that has the consistency, right? And when you break that consistency, the visual consistency and the verbal consistency, it actually leaks the impression, leaks the trust, and you lose the opportunity, and you lose profit, right? So that was, I was like uh, elaborating the sense of like visual part, that how it actually helps you. A well designed, well crafted custom branding can also increase your brand or the practice perception value. You can actually make a difference proposition, and which is uh, feel like that you own, and feel like sense of like ownership, sense of uniqueness, and sense of like memorability and uniqueness. So obviously that is simple, because we as a creator, we as a like oftentimes we forget that our human mind, since we have that infinitive amount of capacities, but we have to understand that our brain capacities. So when it is all the things to design, when we design or apply this design thinking to make it simple, make it memorable, make it uh, distinct, even the most important thing, which is, let's say that, functional, right? So if you like design something, let's say that a logo that you have designed, it works in the digital media, but it doesn't work, or it is not ideal for the offline media, maybe the printed, maybe the signage, right? The different, it has involved with like different color code, right? Digital media has the different color setting, and print has the different color settings. So you gotta like have that understanding, since you have like that clinic, when as a solo practice owner, so that you have to understand this, you know this. But you see that most of the like group practices or the large practices, so they are aware about their branding first thing, because they know that everything that need to be consistent. And when you are consistent in your visual, in your verbal things, it increases your patient case acceptance, right? It increases the booking number, and it helps you also like referral and word of mouth. So promotions, right? So that's very powerful. So when you weigh that now we can actually talk about the verbal thing. So you actually, the visual way that you can build that brand experience. Now the verbal things, let's say that you have well everything like hi-fi or luxury, elegant, your interior elegant, your design and branding, all the things that you have designed totally amazing. But you, when the patients enter the door, um, and speak, they make a conversations with your like team, front end, even the you as a person. So you don't have that idea of like the sales process, right? What is like true sales means. It is not about to like sell, but it is all about to, hey, like um, give them a, patience, give them courage or confidence that they can actually buy, right? You don't need to like you don't need to be pushy, don't need to be very like show or force themselves, right? And that's the case here. When they actually want to learn more about your information, they are concerned about, they are also, oh, like comparing, they are also taking in like gathering the data, because it's just like fingertips way, right? That everyone have that advantage of the technology, that they are like within a minute just search online and they can find bunch of like clinics. So if you are not aware of about the verbal communications, it comes with, let's say, that how you care themselves, right? It's not about to like that how you actually offering your treatment plan at the first time, but you actually even and not uh, empathize them enough, not given them some space to like process the actual thing that how actually works, right? So you just need to be very very aware about those section. And yeah, so when you as as a doctor at the same time as a you have that understanding of little salesmanship, so you act like an whole new totally different way, and you understand that why actually the they are making delay, or they are still hesitant, right? So then you actually listen them very carefully and ask them the questions, and you know that that's the biggest and the effective one, that how you actually ask questions them, and just take pause to like speak them. And it's really works the way that they started to like expressing themselves. And when you like don't create at this moment any objections after asking the questions, you are like taking pause, and they feel like more independent, they feel like more free. And it's actually increase the credibility as well, right? And they feel the connection. And when they feel like that kind of connection, and it's naturally they try to make the decisions, and they you actually increase the uh, acceptance, right? Case acceptance of the patient, number of patients, and this actually works. And people, you can track that. So when you actually as a treat, like make this conversation this way, and you treat the patients and provide the treatment plan in such way, and you also feel like that the confidence that how you actually have done this, and you haven't like think of like before that how it's gonna be like. Now you as a person that whole new things and whole new mastery, along with your clinical things, and it makes much more fun to you, right? So, and here is another thing. This is the powerful thing. I like this most, uh, because you know that sometimes that you have that all the visual and the verbal things as well, the experience is quite awesome, and you have that the salesman like the sales standpoint, you have that made that good conversations with your patients. Even you have, you cannot uh, like guarantee that that is going to increase your case acceptance. Oftentimes they just want to learn, they just want to take more time, even they are not taking the decision because they don't have that financial um like affordability, not affordability, I would say, that the to depend on someone, right, to make this decision. So they just wanted to learn about this. So when they get back to their home and they actually talk about them, and you can actually ask, there is the thing that you can follow up uh, with the correct answer, right questions, so they can actually feel that. So you might ask them that, is there anything that you need help and we haven't covered that is actually holding you back to make that decision, right? And just take pause that what they are going to like share with you, you will just see the result. And you can also additionally offer them that if you need any kind of further clarity or consultation, we are offering is still free, and book a video appointment, right? So that's where they will feel like more inviting, they will feel like more trustable you are, and you are genuinely trying to uh, meet their goal and get the treatment done so they can actually live a better life. So this is here that you just don't rely on that everything you have all the things. Oftentimes that when you have like that, ignore this process because we have like plenty of patients and we are already booked. But when you as a brand, like when you are your practice is act like a brand, and when some patients or customer peoples like come to you, you have to understand that this prospect has already shown you the interest, right? So you just need to nurture them, right? And following up is a process of like trust, and they will like do the for you if they can't like afford the treatment plan that you have provided them, offer them, but they could do the word of mouth marketing for you, and it's some kind of like benefit for you. You can actually grow without like spending any kind of uh, dollar, right? So that's the whole thing that I actually been experimenting about these things. Even I shared with you already that I am also like learning this process things deeper a way that possible. Still I do believe that if you need any kind of help when it comes to like you are trying to increase your case acceptance or patient communication, uh, I would love to chat with you. And if you like to get the supporting all the sales materials, marketing and branding assets, and then how you get started, we can actually chat and we can actually say that we are fit or not. And it's, I'm not like to like push you to here. Just it can be an an uh, virtual coffee chat. If you are like dentist or solo practice owners, I would love to chat with you, understand the your business, understand your dream. So thank you so much for being here, and I hope you found this useful. Please feel free to like share if you have any comments, write down in the comment section, and I will give you the answer. And I will also like dropping this video on YouTube, so you can check this out. And thank you so much again. I appreciate, since I can see that no one today has joined. So yes, of course, for me, I know that a lot of people check this content. Even I was like noticing some of the like popular, I mentioned earlier, that they have been like posting that countless contents, right? They have that similar path gone through. So this is the process that we need to trust, right? So at this moment I am open. I'm taking like projects, design projects, or if you need any partner, or a planner, thought planner, um, so making decisions effectively, I would love to chat with you. I will share my booking link in the comment section. So that's for today. I will see you in the next one tomorrow. Bye bye.